you mind introducing yourself, your name, your position, and what you'd like to do?
Okay, so I'm Francesca. I'm one of the SHOs of two, actually, in neurosurgery at the moment. And my ambition is to become a neurosurgeon in the UK.
So can we ask what your current job involves?
Yeah, so as a junior doctor, every day I round with my registrars and with my consultant in the morning. And then I need to make sure that all the jobs that needs doing are done, which involves checking daily bloods, organizing imaging post-op, writing discharge letters and reviewing any patient who becomes sick during the day on the ward, and then liaising with my seniors and just making sure that we have a plan for every patient. When I'm free and I'm not too busy on the ward, I can go to theatre sessions and I can attend clinic if I want. And I'm also part of the on-call rota, so I do nights as well on call, and in that occasion I cover the entire hospital, so both neurological and neurosurgical department, and I am on call on weekends as well, and long days, cracking TCIs or seeing emergencies and sick patients on the ward.
Why neurosurgery particularly?
I'm definitely sure that I want to be a surgeon, and that is because I like to see an immediate effect of an operation on the patient. The patient comes in, he's unwell, he goes to theatres and he comes back. He's already better, and that's why I picked surgery. Neurosurgery in particular because I really find neurosciences themselves fascinating. I like the fact that there's a clinical correspondence for every type of pathology, so it's really, the neurological examination is really interesting, and you can already have an idea of what's going on just examining the patient. Also, I like the variety that neurosurgery have to offer, because there are so many different fields in neurosurgery themselves that each consultant has a different theatre list with different pathologies and different kind of patients.
What would you say are the best aspects of your job?
Well, as a junior doctor, we still are in training, so what I could say is probably I really enjoy learning every day. Every day is a sort of school day. Every day you learn something new, and even when you're on call and the patient becomes unwell, it's challenging in the beginning, but then it's really satisfactory when you have your own plan and you see how that plan made a difference for your patient. So as a junior doctor, I would say that learning so much and being able to deal with acutely unwell patient is the best aspect of the job at the moment.
May I ask where you studied?
I studied in Italy.
In Italy. And what was it like studying in Italian medical school?
So in Italy, med school is a 6-year degree. So in the first 5 years is mainly studying for exams. We have 2 sessions a year, 2 exam sessions every year. So in January, February, and then July and September we just sit our exam, and all the other months we are just attending lessons. From the 3rd year onwards we are allowed to attend wards as well, where we can go to theatre if we want, we can shadow some of the registrar on the ward or in clinics. And then the last year is slightly different because at least 6 months of that year, if not the entire year depending on the project, we are asked to prepare a dissertation and to create our own project. It can be either a basic science research project in the lab with some supervisor, or it can be a clinical research project on the ward as well. So I think one of the main differences between UK and Italy is that in Italy we don't have the foundation program, which means that we have 6 years of med school, and already at the end, I would say the 4th of maximum 5th year, we need to decide which specialty are we gonna apply for, because we need to write a dissertation that is in that specialty basically, because when we apply for specialty training soon after the dissertation at the end of med school, we get extra points if that dissertation is relevant to our specialty. So what happens is usually when you're a 4th, 5th year student, you ask for a meeting with the dean of one of the departments. In my case it was the chief of the neurosurgical department. I told him that I had an interest in neurosurgery. I asked him for permission to attend regularly his ward, his theatre and his clinics, and then I already knew I wanted to do neurosurgery, and I wrote my dissertation in neurosurgery. So I think that's the difference compared to this country when you have 2 years of foundation, when you actually rotate in different specialties.
So you had to decide quite early in comparison to us.
You do have to decide quite early because soon after med school you just start straight in your specialty without foundation. That means that you need to have a basic knowledge of that specialty already.
What made you decide to come work in England?
Okay, so the main reason is that I think the Italian system has a lot to offer in terms of education. I think that my medical school and most of the medical schools are really good from an academic point of view. They offer you opportunities from research and clinical knowledge point of view. But especially for a surgical trainee, the exposure to theatre time and practicing surgery in theatre is a bit tricky because the surgical training is much shorter. So let's say for a neurosurgeon in Italy, you finish med school, you apply for neurosurgery, and then it's a 6-year training program to become a neurosurgeon. The reality of things is because of the numbers of trainees and because of how the system is structured, at the end of those 6 years, you are not really independent. So you have finished your training, but you still need a lot of support from seniors in terms of operating skills and needing supervision in theatre. So the main reason why I moved to UK is because I think the UK system is a bit more structured. It's longer, but it's also more structured, and the learning curve is a bit more progressive. When you become a consultant, you're supposed to be really independent and able to operate on your own. I think also the UK system is a bit more flexible because you can take time off from training to study for PhD or for master's degree. And if you have the other main difference is that in Italy you start and finish in the same hospital. If you apply for specialty training, the training is going to be in the same hospital for the entire 6 years of training. While in UK you rotate in different hospitals, and I think it's another good opportunity to see different techniques, meet different people, and learn different things from different consultants and registrars.
So you've given us a few lectures, and you mentioned a bit of research that you've had to do as part of your course.
Yeah.
Are you interested in doing teaching and research alongside your
I'm
future job?
really interested in teaching. I'm taking every opportunity I have to teach students. I'm happy to teach on the ward or more formally in lecture when I have the chance. Research-wise, I'm currently studying for a master in trauma sciences because in neurosurgery what I enjoy the most is trauma. So I'm currently on the 2nd year of my master in trauma sciences, and I'm expected to finish it this year. And it was another good opportunity that I had just to improve my knowledge in neurosurgery and trauma overall.
Sure. What would you say is the most challenging aspect of your current job as a foundation doctor?
Now, foundation doctor is a doctor on the ward, which means you're pushed and pulled by everyone. You have nursing staff that keep bleeping you for any sort of job. You have your registrar and your consultant, which expect you to be aware of what's going on with your patients, and they expect you to sort out the patients. And at the same time, you're also a trainee, so you also want to have some time to go to theatre and to clinic and to learn actually something. So dealing with stress on the ward really is probably the most difficult thing, because sometimes you would rather be in theatre or you would rather be learning something somewhere, and you're asked to do repetitive jobs, and that can become stressful and a bit frustrating sometimes. And also when you start dealing with acutely unwell patients, especially in foundation, because you keep changing rotation so often. Every time you start a new rotation, you have to learn the main bits of that specialty, and that can be challenging in the beginning.
You mentioned it can be stressful. How do you cope with that stress?
I think teamwork is probably the key. Other foundation doctors are going to be around, co-trainees are going to be around, sister on the ward, if they are senior sister, really experienced, they can help you out. So from my point of view, what I tend to do is to become friend and work in team and help out, help each other out. So that's a good way of dealing with the stress, because you know that someone is going to be there to help you out the moment you need it. So be friend with the nurses, be friend with your colleagues, and be nice and open with your registrar and consultant as well. That's the key to survive.
You mentioned you have a particular interest in trauma within neurosurgery. Is there any other parts within neurosurgery? Like, what are the other parts? Sorry.
So neurosurgery is really broad, and when you're really junior, it's difficult to know already what you want to do. Vascular and skull-based are two really challenging areas of neurosurgery. Operation in that fields are really long and they're really tricky, and the patients can get quite a few complications. So that's a very interesting part of neurosurgery. That's really interesting, and going to theatre and seeing that kind of operation is really amazing. At the same time, it's really demanding. If you want to train in those kind of subspecialty, you need to take fellowship, you need to be really skilled to do that. Spine is another interesting area, especially because I have an interest in trauma. Complex spinal pathology is really interesting, fusions or other kind of procedure, and there is a lot of development in that area as well, with different approaches that are coming out. So those are probably the main areas I'm interested in.
Do you have to go on call much?
Yes, we have an on-call rota. Is more or less 1 in 9, which means we rotate. It's 9-10 junior doctors. We rotate with our on-call duties. So at the moment, I have an average of 3-4 nights every month and a half, and then probably 1 weekend every month as well. Pretty much depends on the hospital. It depends a bit on the hospital. In this hospital at the moment is quite good.
What is the most interesting/exciting thing you've seen within your training?
Okay, it was the removal of a craniopharyngioma from the brain. That was in Italy. It was really interesting because craniopharyngiomas are tumors that are literally in the middle of the brain. So the chief of neurosurgery, of course, was doing the operation, and seeing him being able to remove this tumor that was probably 4 centimeters literally in the middle of the brain with an operative field that was probably as big as a watch, not more than that. So that was really amazing, and when I saw that, I was like, that's what I want to do.
And finally, what advice would you give to someone thinking of applying to study medicine?
To study medicine, I think if you want to do medicine, you definitely need to be interested in learning about anatomy, about physiology, and about diseases overall. So that's something you need to enjoy, and you need to be worth studying, and you need to be interested in it. But at the same time, you need to be aware that the daily job as a doctor requires a lot of patience and a lot of teamwork and dealing with other people and patients around you that are going to be demanding and are going to put a lot of pressure on you as well. So what I suggest is get some exposure. If you can, go to a hospital, or in my case what I did, I applied for charity work in a hospital, so I had the chance to stay there for a couple of weeks and just be around on the ward, have a look at what was happening, and make sure that not only you're interested in medicine itself, but you're also happy to deal with the daily jobs that you're going to be doing as a doctor.
Thank you very much.
Thank you.
No problem.